Okay, good afternoon, Ma'am Joyce. I am Brian Hortas, and I will be your physical therapist for today. So as I review your chart, you are a 23-year-old tennis player, and you complain of um, when you serve the ball, your arm goes dead, and you have this problem for 3 weeks now.
Yes.
Okay. So you have increased your training during the past month. Is that correct?
Yes.
You report also diffuse pain on the left arm, and you get tired easily, and tenderness felt on the upper area of your left clavicle. So you are left-handed.
Yes.
Okay. So as the patient entered the clinic, vital signs are normal. So your vital signs are normal. So we can proceed to our treatment or our procedure. So I've also reviewed your chart and confirmed your history. Okay. So let me just observe. Can you turn your back on me? Okay. Due to the hand dominance, the left side can be seen slightly inferior compared to the right side. And can you move sideways? Okay. Face sideways. Okay. Okay. Face me. This same observation on the shoulder, and there is bigger muscle mass on the dominant hand. Okay, that's all for the observation, and let's proceed to our proper procedure and our proper treatment. So remember, we have five specific procedures. These are just special tests and deep tendon reflex. So these are just to address your symptoms or signs that you complained of. Okay, so let's start. Um, do you feel any? Are you in a relaxed position? Okay.
Yes.
Mm. Okay, so let's start with our special test. First is our Posen test. So, position, face me. Relax your elbow on the table. So this test is to help us determine the tennis elbow. Okay, so which is your um, main complaint. So okay, relax. Okay, I will stabilize the elbow and palpate the lateral epicondyle. Make a fist. Okay, and then turn your fist like this. Okay, and point your fist inwards. Okay, and put your bend your or straighten all the way up your fist. Okay, as I apply resistance. Okay, go. Do you feel any pain?
Yes, I did.
Okay, there's pain. Next is our meal test. This is the same test. Can we go back? This is just to assess and help us determine the tennis elbow sign. Okay, just relax. Do you feel any pain?
Yes.
Especially here.
Yes.
Okay, there is pain. So let's proceed to our DTR. So your these two tests, special test, is helps us determine what you really feel about your main complaint, which is your arm goes dead when you serve the ball. Okay, so for our next procedure, this is a deep tendon reflex. So this is just to assess your nerves, and since your arm goes numb whenever you serve the ball. Okay, just relax. Relax. Okay. Okay. Okay, that's not bad of a DTR result. Okay, let's go now to our this is last two special tests. This is to confirm and aid me, physical therapist, in your thoracic outlet syndrome. Since the later part of your complaint, you complained of diffuse pain on your left arm here, and you get tired easily, and tenderness felt in the upper area of your left clavicle. So that may cause because of your impingement of the artery, or deterioration of your deltoid muscle, which is this muscle. So this muscle originates in your left clavicle here. Okay, so this is the RUS test, or the thoracic outlet syndrome test. So whatever I do to your arm, to your hand here, do that to the side also. Okay, and hold this. I want you to open and close for 3 minutes. Assuming we are on the 2 minute and 50-second mark. 10, 9, 8, 3, 2, 1. Do you feel any pain, especially tiredness over here compared to your right?
Yes.
Okay. Next is our Addison test. So the RUS test was to help us address the tenderness on the upper area of the left clavicle. So this now is the Addison test. This is to address your complaints of diffuse pain on your left arm, and you get tired easily. So that may be a result of a impinged artery right here in your thoracic outlet in our field in physical therapy. So just relax. Okay, I want you to straighten your neck and look to your left. Look to your left. Okay, and take a deep breath and hold. I will palpate for the radial pulse, the attitude or the characteristic of the radial pulse. So it's slightly lower down or decreased, and it is weaker. So do you feel any discomfort during our treatment or procedures? So apart from there is just pain, especially in the special test. Okay. Okay, so that's about it for our physical therapy session. So unfortunately, our procedure test turns out positive. The procedures, or those procedures really address your complaints. So for our next session, we will start rehabilitating. We can start and address your complaints, since we already had our assessment and procedures about your tennis elbow and the later symptoms and signs that you complain of. So that's about it. Thank you, and see you in our next session. I will check your vital signs before you leave. It is all normal, very good, and see you. And I will perform aftercare.